This short lecture is part of the What's on Your Mind project, and it's about post-traumatic stress disorder. My name is Dr. Mark Coombe, and I've been a doctor for over 30 years. And my first 10 years as a doctor, I was working in the army. During that time, I got exposed to a couple of fairly traumatic events, one as a doctor with a bomb disposal unit for 6 months, and one in the besieged enclave of Gorazda in the former Yugoslavia. So over the last 30 years, I've treated a lot of people with post-traumatic stress disorder, and actually I've dealt with it myself. So I'm going to talk about some of my experiences, but that's going to be covered in another talk. But really the point of this specific lecture is to give you the background of PTSD and help you become more able to recognize it, both in yourself, in your friends, and in your family. So don't forget that suicide is still extremely common as a result of PTSD. And really in 2023 going forward, we shouldn't have servicemen dying. So let's start talking about it. Let's not be embarrassed about it. And let's try and get the treatment and everything started and initiated and improved. What's the background of PTSD? So what's the history? When did we first start talking about it? Well, in all honesty, PTSD has been alive while the human race has been alive. So any human being that's exposed to the right sort of trauma or the wrong sort of trauma will end up with some sort of post-traumatic syndrome. It was first described in the literature in World War I, and it was called shell shock. And people with shell shock, some of them were executed as deserters. And that's where one of our problems arises, in that the culture of the UK forces was that if you showed trauma, if you showed psychiatric illness as a result of being at war, then you were persecuted and sometimes killed. And so that really has been the background to putting a negative spin on people admitting that they were not feeling emotionally well after being exposed to trauma. It wasn't described as PTSD until in the 1980s after Vietnam by the Americans. And it's not just confined to servicemen. In fact, PTSD is more common in the civilian population than it is servicemen. But it's all triggered by an event often perceived as life-threatening, but it does include things like child abuse, sexual assault, and domestic abuse. So who is most at risk of PTSD? Well, service personnel have got to be up there in the high tops. First responders, your ambulancemen, firemen, because they have a high exposure to traumatic events. If you're living in a different culture, so if you go somewhere where people don't understand your language, or if you go somewhere where they do things very differently. So for example, even me going to somewhere like Spain, I would be living in a different culture. You are more likely to be traumatized by a specific event. You're more likely if you've had it before. You're more likely if you've had previous mental health problems, and lots of people have suffered with anxiety and depression, and so that does make it more at risk. It's twice as common in women, and it's much more common in people who've got long-term illnesses, and that can be anything from a bit of arthritis to asthma, diabetes, chronic obstructive pulmonary disease, and it really is very common after childbirth. So what makes PTSD more likely in service personnel? Duration of combat. So it doesn't take much for it to trigger a PTSD reaction, but the longer you're exposed to a combat experience, the more likely it's going to happen. Low morale in the unit that you're serving in at the time. The lower your rank at the time of exposure. If you're single, so you don't have any particular support when you get home. If you've had poor social support in your life or actually at that time. If you're an attached unit, so if you're a medic, if you're in the REME, if you're catering, then the chances are that the people that you serve with, you may well go back to another unit, so you don't have that support. So attached units, particularly as I say, like the REME and myself, you are more likely. If you've had childhood adversity, so if you've had a difficult upbringing, and if you've had a poor schooling or poor outcome of schooling, that makes you more likely. So lots of people are very angry these days, aren't they? And they say, well, why is PTSD missed? It shouldn't be missed. And the reason is it's not just one thing. It's quite a mixed batch of symptoms and feelings. And so sometimes there's no immediate symptom related to the event. So it doesn't happen for maybe 5 years, 10 years, 20 years. Certainly in my case, I didn't really feel I had PTSD until about 14 years after my exposure. It's often misdiagnosed as depression because the symptoms are very similar. It's often confused that people come with drug and alcohol misuse, and that's caused by the PTSD rather than the main problem. So I'm sure if you looked at Alcoholics Anonymous and various other supporting agencies, you would find that a number of the people attending for that have got PTSD, and really the drug and alcohol misuse is just a symptom of the PTSD. And that's the same in anger and relationship issues. People who just don't feel right and can't put their finger on it often attend the doctor quite a lot with mild symptoms, and as a result that gets the clinicians sort of less able to notice. It's the old sort of crying wolf scenario. So people, if you find that your friends are starting to go to the doctor a lot with what you think is minor illness, you might well want to talk to them about what's that real underlying problem. So what are the common features? There are loads and loads of features, and I'm not going to go into it in great detail, but it's unwanted thoughts or nightmares about events. People avoiding situations that remind you of a specific event. Feeling on guard, watchful, or easily started. I remember a plane flying over when I was walking through a street in Salisbury, and I almost threw myself to the floor, and everyone around me looked at me as if I was completely mad. But it felt completely normal. I felt very scared. People feel numb or detached from others. And I think if 2 or 3 of those applies to you, you probably want to seek further medical help because you may well have PTSD. So what's going to happen if you get diagnosed with PTSD? Well, you're not going to get shot anymore, which is a relief. But about 80 to 90% will get better by themselves. Symptoms may occur many years after the events, which is what I said, so don't be scared to get treatment because although symptoms still occur, treatment is still effective. And the treatment, there's multiple types of treatment, including talking therapy, drugs, and much, much more. And a lot of them very evidence-based, a lot of them will make a difference, but you don't know until you try. So don't be scared if you get that diagnosis. So who are the useful people to talk to? Well, you may well have friends and family, really anybody that you trust. If you haven't got anybody in your social support network, go and see your GP or your medical officer or your welfare officer. And there's some amazing regimental resources like the REME Connect page. And we'll put much more stuff out there. And there's a couple of other things at the bottom, Combat Stress and indeed the Samaritans. So thank you so much for watching. Let's all keep talking about how we feel and let's get on top of PTSD.